Welcome everyone to Mayo Clinic Q&A. I'm Dr. Helena Gazelka. The immune system protects the body from bacteria, viruses, and illness. As we enter flu season and with the COVID pandemic continuing, it is more important than ever to keep ourselves in good health and to do all that we can to remain healthy. Today we ask, are there things that we can do to boost our immune system? Here with us to answer that question is Mayo Clinic internal medicine physician, Dr. Anjali Bhagra. Dr. Bhagra is an integrative medicine specialist at Mayo Clinic with a clinical practice and research focus in resilience. Welcome to the program, Dr. Bhagra.
Thank you so much, Dr. Gazelka, for prioritizing this topic. And as you mentioned, it's so timely. I'm honored.
We are all trying to do things that we can to prevent the spread of COVID and now flu season and upper respiratory illness and colds. And so this is a very timely topic. So thanks for sharing with us. Could you tell us first about resilience?
Resilience is a construct, and it can mean different things, but I'm going to simplify. And I will try to avoid scientific descriptions. So resilience is our capacity to bounce back from any kind of adversity. And actually, I would argue it's not just bouncing back, but it's growing from. You know, we experience a setback, and then with all of our learnings and our bandwidths, which includes 4 different domains: physical, so resilience has a physical component, emotional, spiritual, mental, and then in the context that we are talking today, immune. So immunity. So I think resilience is that ability of us to bounce back.
If resilience is bouncing back, how does it relate to the immune system, and what does immune resilience mean?
So immune resilience is basically the ability of the body to be a good soldier against let's call these inflammatory attacks. And our immune system works across a range of activities. So we want our immune system to be activated in time, on the right path, and in the right dose, because our immune system can sometimes be underactivated or on the other extreme overactivated when it kind of begins acting against our own bodies, or a condition where what we call autoimmunity. So a resilient immune system is right in the center, where it's doing its job and not just preventing, but constantly eliminating our exposures to background infections or inflammatory agents. And it really allows our body to keep sort of healing as we go along these micro insults from inflammatory or infective triggers.
So I hear you saying that our immune system can sometimes underreact, sometimes it can overreact, but there's a good balance in the middle. And I'm wondering, what factors are there that affect how our immune system responds?
There are several factors. I'd like to simplify this into the concept of what we consume is what determines where our immune system lives and how resilient it is. So let's start with nutrition. So as everything else, there are some basic foundational things that help build a nice, resilient immune system. And nutrition is key to that. So diet, from a diet standpoint, what we consume is critically important. Second would be restoration. Our body needs to recover. And so good sleep, critical component of a well-functioning immune system. Third in that list would be exercise. How do our muscles get good nutrition, good blood supply? Are we doing our bit in physical exercise? And a key component along with all of these is effective stress management. Here, I really am talking about how do we consume the news around us. You know, as we've all seen, especially in this time of our pandemic, the doom and gloom and this constant news cycle and all kinds of reports coming in, being very careful about how we pick our channels of communication. What are our trusted resources for those news that we want to stay on top of? And then finally, I would say relationships. And managing stress is one aspect, but investing in our joy And happiness is the proactive or forward moving part, which I think is critically important for that complete resilient immune system. So it's multifactorial. It seems intuitive, but I will just share with you, this has been studied systematically by different principles, and all of these components are critically important for us to have a robust, a resilient, and optimally functioning immune system.
I'm going to guess that almost all of our listeners have heard of the concept that stress can make you sick. How does stress affect the immune system?
So stress has a very, again, multifactorial impact on not just our immune system, but immune system is then related to our metabolic system. And, so there is a complex interaction of how stress impacts the entire functioning of the human body. Now, I know that several of our listeners who have experienced certain autoimmune diseases, what you may have heard from your patients as well is flare-up of certain conditions when they were stressed. And I see a lot of those patients in my practice. I have a general medicine consultative practice, and I have stress management practice. And I cannot even begin to tell you how many times I sit down with patients who come up with flare up in their rashes, in their underlying lupus, because they were going through a very stressful time in their lives. This phenomenon of direct interaction of stress with our immune system functioning has been studied under multiple settings. One that I'll share quickly with you is in relationships. So marital stress, for example. I don't know how this study got the approval from the review board, but the researchers actually studied the healing rate of blisters in couples who sorted out their marital discord amicably versus with animosity. And the ones that were not able to amicably sort out had much longer healing time of their blisters. So that stress or discordance actually significantly impacted healing time. So this is one example. I'm not sure why I thought of this particular one, but just to drive home the point that stress, mental stress, has a huge impact on our recovery. It's not just emotional recovery, which we talk a lot about. It's not just mental recovery, it's immune recovery, it's metabolic recovery, because stress has also been impacted through neurohormonal mediation to escalate heart attacks, for example. So it's complex, but it's well studied and it is well documented. Stress is not our friend.
And so when I tell my husband that he's a pain, it really is genuinely true.
It is genuinely true. And I will send you the study so you can quote it.
That's great. We all see commercials and ads for supplements and vitamins that are supposed to improve or boost our immune systems. Are there actually food supplements or types of food that do boost the immune system?
We actually see patients for these specific consults within the integrative medicine section at Mayo Clinic. And this is a question that we come across a lot. So when we talk to our patients, when I talk to my colleagues, when I actually talk to my kids and my family members, there is studies, not like with a cause and effect model, but studies looking at the role of, let's say, micronutrients, a certain kind of nutrients to boost up our immunity. But most of these things we recommend that we get directly from our diet versus in the form of supplements if possible. Okay, so our general advice before we recommend anything as an additional immune booster is to get everything aligned in those domains that I spoke with you earlier about. So good, balanced diet. And the more we get micronutrients from our diet, which includes vitamins, the better it is. And when I say diet, I mean a holistic diet, full of a colorful diet is a holistic diet because you've got your veggies in it, you've got your fruits in it, you've got your green leafy vegetables in it, which are inherently rich in substances called flavonoids, micronutrients. And so a balanced diet is the best way to get your nutrition. With that understanding, in certain instances, we do support supplementation. I've sat down personally with a lot of individuals who feel very connected or attached to their multivitamin pill. Now, if you ask me in terms of long-term studies, we don't see a mortality benefit. And in certain instances, in fact, we may see a reverse relationship. But we know that enough certain micronutrients are key for us to effectively fight infections. And these would broadly include vitamins, especially vitamin C. Its role has been studied in upper respiratory infections, even prior to this COVID pandemic. And then more recently, there has been a lot of talk about zinc. And again, these are not conclusive long-term research studies, but it has been suggested in preliminary studies that adequate intake of zinc prevents the virus from entering the cells. So it kind of, in some ways, limits the virulence if you were going to, or the infectivity of the virus if you were going to get this infection. So there's definitely a role of appropriate intake of nutrients to prevent infection.
Related to what you said about supplements and about healing, I had a family member recently have surgery, and they were dosing with some high doses of vitamin C in the hospital. And I asked about that, and they said that there were now studies showing that wounds heal better with vitamin C. So they've been doing that recently, which I found very interesting.
Absolutely. So the whole mechanism, thank you for sharing. That's such a great example. And the whole idea is to provide that antioxidant to promote recovery.
What other things can we do to protect ourselves against the flu or even other long-term illnesses?
Some of the lifestyle stuff that we talked about, of course, highlighting the role of nutrition, sleep, adequate rest, as well as managing our stress. I think, especially in this season, prevention is key. And I cannot reinforce enough the importance of all the measures that have been highlighted by infection prevention control boards across the globe. So definitely appropriate preventive measures, including masking. And we are a big proponent of universal masking because, like I said, I mean, if we need to, yes, we will treat, but there is no miracle cure right now for either of these conditions. So in addition to social distancing, maintaining or minimizing your exposure to these infective agents is key. And I would just reinforce that, not to undermine the importance of prevention in these settings, especially with the upcoming flu season. So maintaining distance, use of mask, and I'm hoping most of our listeners will consider getting a flu shot as soon as it becomes available.
During my medical career, it has often occurred to me that patients experience what appear to be very similar experiences medically very differently. In other words, I've often considered that people have different coping mechanisms or ability to cope with experiences that come their way. Are there things that we can do to improve our coping and to boost our resilience if we don't feel it's adequate?
We all have unique ways of handling stressors in our lives, and we lean on different mechanisms for healthy coping. And I would just reinforce that message that you shared so eloquently with the understanding that, this is also a well-studied field. How do people cope? So especially in the context of our current pandemic and prior pandemics, this has been extensively researched and written about, what is the level of stress on, I'm just going to take the advantage of essential workers in settings of pandemics. And then what are the ways people cope? How do they keep going in such moments of uncertainty and intense stress? And we at Mayo have done different groups within Mayo who are interested in this space with well-being, resilience, have worked in this area. And what we found from one of the surveys that we've conducted here is the importance of 3 F's as being pillars of coping based on responses from our colleagues all across the healthcare workforce. And these 3 F's include fitness. So a lot of individuals lean on focusing on their fitness. And as you and I have talked through that, I think that's been a big thing that we've highlighted. Within fitness, all domains of fitness are important. Physical fitness, emotional fitness, spiritual fitness, mental fitness, and immune fitness. Okay, so that's your first F. The second F is position and value of family. I cannot even begin to tell you how important having a family is to people. And when I talk about family, of course, you know, it's your near and dear ones, it's your loved ones, but the importance of work family, your community as your family. We've all seen examples of excellent community responses. The youth in our community have come forward. There are so many other groups that have come forward. So I would encourage all of us to think about family as a broader context. You know, family is any human being that we can have an impact on. And I'm hoping that this podcast will reach out to several who are our family now because they are listening to us or spending the time with us. And finally, the final F is faith. I think, you know, as much as we love to research things within healthcare and medicine, one thing that remains underreported or sometimes we are not very explicit talking about, and that's faith. That is a strong pillar as a coping mechanism for people that's come out, at least in our studies. And personally, I have a strong spiritual faith. I have faith in my organization. I have faith in my colleagues. So there are so many different ways of activating your faith. So think about those 3 Fs.
Do you have any final tips for us, Dr. Bhagra?
You know, my biggest tip that I've learned from a lot of my colleagues, including you and others, is yes, we are in times of great uncertainty. We are in times of fear. So use the 3 Fs of fitness, faith, family over the F, the fear from the pandemic. And do not postpone joy. Anytime you invest in your joy, you invest in your immune resilience, you invest in your emotional resilience, you invest in your physical resilience, and you invest in your mental resilience.
Our thanks to Mayo Clinic internal medicine physician, Dr. Anjali Bhagra. I know I learned a lot today, and I hope that you did too. We wish you a wonderful day.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu. Thanks for listening, and be well.